If you take your mind back to sort of January January last year, we started really hearing about it in the news, didn't we? And then March, obviously, was when we first started taking our patients. What was the feeling on the ward at that time?
It was really terrifying in some ways. We sort of saw the news with everybody in hazmat suits and everybody full alert, taking people, and you sort of think everybody's dying. And then they started bringing food in for us. So Leeds Cares would bring us packages of food in, and people off the streets would bring us food in, and pizzas would be delivered, which was all lovely. But it made me feel like I was going to war. It was really difficult and really emotional and absolutely terrifying.
Yeah, I think to be honest, I can remember I can't remember their name, but I can remember the first patient because our queue had emptied. Within about 24 hours, everybody had gone. And then I was sat at the nursing station with one of my band 5s, and the registrar came onto the unit and said, "Oh, there's a patient in A&E who suspected COVID." And the nurse who was next to me went, "Right, here we go." And we were just so geared, ready, waiting for it. So yeah, the first few were you were kind of running on adrenaline.
Yeah. It's been quite relentless actually for the teams, and obviously in the service you provide, been pretty much in the thick of it throughout.
The hard bit was just the amount of deaths that we saw. We were having at least one a day. And to be honest, we still are still having at least one a day. Not all of them COVID now, but yeah, we're still seeing a lot of death.
So there's the extreme around critical care and the RCU and the RQ wards and the respiratory wards, and then the ward that you were in, we had COVID patients, but they were less unwell COVID patients. So
they maybe just needed a little bit of oxygen therapy or something like that. But they weren't critical patients. So it just helped me relax a little bit into the fact that we are still doing a job and it's a good job.
When patients started coming through, were they the same cohort of patients that you would normally see with COVID, or was it completely...
No, not at all. Our ward closed before the COVID patients started coming. And I got moved to Ward 49, which was the renal ward. And I think I worked one shift on there, and then that ward got closed as well. And then when I came in for my next shift, they were like, "Oh, you're going to Ward 50. And I turned up at Ward 50 and it was already a hot ward. So I sort of went from being absolutely terrified and not having seen a COVID patient to working a night shift on a ward full of COVID patients. And I remember thinking, "Oh, I can't do this, I can't do this." I just, pure panic. And then having to do it because that's my job and that's what I have to do. And I worked the night shift. And actually it was okay. You're gowned up and you got all your PPE on. And then once you see them and see that actually it's not a zombie apocalypse, everybody is still patients and they are still my patients. And they were coughing and they had temperatures and they were unwell, but not critically unwell. And it was a bit of a light bulb moment for me. It was a bit, it's okay, is this not everybody's going to die? We are going to get through this.
The PPE element. And we've heard a lot in the news and things like that, and pictures on social media of nurses with marks, and doctors and therapists with marks on their faces and things like that. And I'm not sure, I've been able to wear one of the normal surgical masks. I haven't had to wear the FFP3 masks. What does it actually feel like to wear that for a shift?
It's quite claustrophobic.
Yeah.
It's claustrophobic and warm. You just, say to one of the girls literally this morning, she's like, "I can taste my sweat off the top lip."
Oh really?
And we were only in the room for about 10 minutes.
Yeah.
So yeah, it gets really claustrophobic.
Gowning up and going into the patient, and I found that really hard, the having to wear the face masks and having to wear goggles and the full PPE. I'm very tactile, and not being able to touch my patients was really difficult for me, and hiding my face from them was very difficult.
It's like coming out of the room, you just felt contaminated. You were like, right, very careful what you touch.
Yeah.
If you accidentally touch something, you scrub it to within an inch of its life.
And how did that feel then, going home to your family?
It was hard at first, because at the time my wife was pregnant. Right. And my son was born in June.
Oh, congratulations.
Finishing work and stuff for my wife. Being pregnant at the time, it was scary. You don't know what you're taking home. Yeah, we've got one of the girls that both made this out of an old pillowcase, so you put your uniform in, so you should come straight in the washing machine. So with that, and I just didn't let my wife touch me or anything. Like, we were just obsessively cleaning the car. It has been hard. It has been really hard. And it's, to be honest, it still is. It's not. It doesn't feel any easier now, because we're still getting all of our COVID patients. We're now getting all of our regular patients, for want of a better term, regular patients, but our usual patient base back in. So the kind of combination of both.
I was completely paranoid that I was going to take something home to somebody. I was showering every day before I left, washing my hair every day. Clothes, my clothes were in a pillowcase that went straight in the washing machine on a very hot wash. And you almost don't want to touch anybody at home. You feel a bit like you need fumigating outside the house before you go in. But yeah, it was really scary.
So that was Surge 1. And then started going through to Surge 2, Surge 3, Surge 4, and of course the hospital is full. In terms of the work over this last sort of like 9 months up to this point, has that gone back to normal?
No, it's a long way from normal. We are extremely busy on the ward at the minute. The way we work is very different anyway because of the COVID testing all the patients and the things that we have to do, and they're putting the PPE on. But even just the sheer volume of patients, we are at capacity, I would imagine. We're seeing lots of people that are staying with us quite a long time, which is unusual for us. People aren't going home, people are coming back COVID positive and we're having to move them, and then we're having to close bays.
I think the second wave in particular was horrific.
It was hard.
But each subsequent one is kind of, on the face of it, probably not as bad, but because you're just knackered.
Yeah.
Like all of them are knackered.
Yeah.
And that's like in my role now, particularly like the first, second wave, most of my time was spent just talking to staff.
Yeah. How
are they doing? What are they struggling with? And it was more dealing with that really than kind of anything else that kind of couldn't part and parcel of my job. It was all about staff welfare and getting on. And kind of the difficult part was there's nothing you can do to help at all.
So going back to the staff well-being then, because you mentioned earlier about the volume of death, and I guess a lot of people will think, well, they're a hospital, they'll deal with death, but not to that volume and not every day.
That's one of the kind of best bits about COVID, is that how strong my team is now in comparison to what it was like 18 months ago. I don't get me wrong, everybody has their days and everybody has their moments, but yeah, the amount of help that they all give each other is incredible, really. But yeah, as the kind of months wore on, the CSU hired a clinical psychologist, so he's available, which we get to use quite a lot. And we had unbelievable support from palliative care. They were up, not even to see the patients as such, but to see us. Right, personally, we'll be forever grateful for that from palliative care. They were unbelievable.
So in terms of the next sort of like the next 6 months, because obviously we're going into winter, aren't we?
Yeah.
And it's quite challenging, I think, because it seems outside everything's gone back to normal, but in the hospital it's a long way from being normal, isn't it? How are you managing that?
You manage because of the people around you and the team that you work with, and we all pick each other up and we all keep going. I think the winter could well be horrendous.
So what would you say if people say COVID's over?
Oh, I'm very opinionated on things when people tell me we don't need a vaccine and COVID's over. My family all still wear the masks in the supermarket. It's nowhere near. I think we're a long way from COVID being over. People need to start socially distancing again and being aware of the surroundings and aware of the people that are near them, because I think we're a long way from it.
I don't really know what else to say other than thank you, because it has been the most challenging time that we've ever had in the NHS, and and I know we've got a difficult winter ahead of us, but the work that you've done, it's just been phenomenal, and I really would want you to pass that back to the team. I really would. It's been outstanding.
Thank you very much. We'll definitely tell everybody when we get back up.
I just want to thank you. I know I met you on the ward a few weeks ago. I just really enjoyed speaking with you, and I'm just so grateful for everything that you've done and everything that you're going to be doing, that and your team.
Thank you.